Intrauterine device and surgical method postpartum woman. Intrauterine devices. It is a small plastic device inserted into uterus through vagina. It is a birth control method where it prevents fertilization or pregnancy. So, itong intrauterine devices or IUD, isa siyang long-term birth control which is piniprevent niya yung pag-fertilize ng egg cell and sperm cell. It can be also easily to remove kapag yung babae ay ready nang mabuntis. Dito sa IUD may dalawang option, the hormonal IUD and the non-hormonal IUD. So, these are the two common types of IUD. So, the first common type of intrauterine device is the copper T380 or the Paragard. It is a T-shaped plastic device wound with copper, a non-hormonal, and it works for 10 years. The copper produces inflammatory action within the uterus, creating harmful environment for sperm. So, yung copper na nakadikit sa device, yun yung nag-produce ng inflammatory action para patayin yung sperm. Next is the Mirena. It is a hormonal IUD. It features a drug reservoir of progesterone in the stem. It works for 7 years. And it works by slowly releasing the hormone levonorgestrel in your body. So yung trabaho ng levonorgestrel is to prevent pregnancy by thickening the mucus doon sa cervix para ma-prevent niya yung pag-enter ng sperm sa uterus. So ano nga ba yung effects ng IUD sa pregnancy? First is the miscarriage. Kapag halimbawa pregnant ka tapos gumamit ka ng IUD, may possibility na malalaglag yung baby na pinagbubuntis mo. Next is preterm birth and infection of the amniotic sac and fluid before delivery. Usually, nangyayari ito, it's because of the infection. The woman will receive an early sonogram to document placement of the IUD and rule out ectopic pregnancy. Following confirmation of the IUD's location, it may be left in place during the pregnancy, but it is usually removed vaginally to prevent the possibility of infection or spontaneous miscarriage during pregnancy. Intrauterine device and the adolescent. IUDs are not often prescribed for very young adolescents because such teenagers may not yet have a uterus large enough for a safe insertion. In intrauterine devices and perimenopausal women, the perimenopausal women are good candidates for IUD. In intrauterine device and the postpartum woman, usually done at 6 weeks postpartum checkup and can be done after childbirth. The IUD inserted immediately this way does not affect uterine involution or the uterus return to its pre-pregnant uterine device.
Surgical methods of reproductive life planning. Surgical methods of reproductive life planning, often called sterilization, include tubal ligation for women and vasectomy for men. Ano ang vasectomy? Ang vasectomy ay ang pagputol at pagtali ng anurang punlay o vas deferens. Pamamaraan. Ito ay simpleng operasyon na ginagawa ng isang nagsanay na doktor. Gising ang pasyente habang inooperahan at walang sakit na nararamdaman dahil sa pangmamanhid o anesthesia. Isang maliit na hiwa ang ginagawa sa bayag upang putulin at talian ang anurang punlay o vas deferens. Sa paraang ito, wala nang punlay ang makakasamang similya. Ang lalaki ay maaari pa ring tigasan at labasan ng similya, ngunit ang similya ay hindi na makakabuntis dahil wala na itong punlay. Ang operasyon para sa vasectomy ay tatagal lamang ng 15 minuto hanggang 20 minuto. Sino ang maaaring gumamit ng vasectomy? Para sa mga lalaki na naisakatuparan na ang nais na bilang ng anak at nakapagpasya ng ayaw ng magkaroon pa ng iba. Mga kabutihan ng vasectomy. Ang operasyon ay maaaring gawin sa klinika o tanggapan at hindi ito tatagal ng 1 oras. Permanente. Sa isang mabilis na operasyon, matatamasa ang panghabang buhay na ligtas at epektibong paraan ng family planning. Hindi makakasagabal sa pagtatali. Napaka-kombinyente o maginhawa. Walang epekto sa kakayahan ng lalaki na makipagtalik. Dagdag na kasiyahan sa pagtatalik dahil wala nang kaba na mauuwi ito sa pagbubuntis. Walang epekto sa kakayahan ng lalaki na gampanan ang kanyang mga regular na gawain. Mga kakulangan ng vasectomy. Kakailanganin ng paggamit ng kondom o di kaya pag-iwas muna sa pagtatalik hanggang makalipas ang 3 buwan matapos ang operasyon. May bahagyang kirot sa bayag matapos ang operasyon na maaaring maramdaman hanggang 3 araw. Kinakailangan gawin ang simpleng operasyon ng isang nagsanay na doktor, hindi makakaiwas sa STD. Ito ay walang possible side effect.
Tubal ligation. Tubal ligation, it is a procedure where the fallopian tubes are occluded by cautery, crossed, clumped, or blocked, thereby preventing passage of both sperm and ova. Dito sa tubal ligation, i-prevent niya ang pag-travel ng eggs from ovaries through the fallopian tubes at i-block niya ang pagpasok ng sperm through fallopian tubes para i-meet up yung eggs. So, sa pag-block niya, nagkaroon doon ng no fertilization. So, ibig sabihin ng no fertilization, walang mabubuo or hindi siya magkaroon ng baby, hindi siya magbuo ng baby. Of course, at it does not affect the menstrual cycle if you will do this procedure. Ibig sabihin, if yung nanay na dumaan siya ng tubal ligation, yung menstrual cycle niya is the same. Regular man siya or regular. And yung pag-mins niya, yung pagregla niya, tuloy-tuloy po siya kahit dumaan siya ng procedure ng tubal ligation.
What to expect during tubal ligation? During tubal ligation procedure, you will be placed under anesthesia so you don't experience any pain. Anesthesiologist will monitor the anesthesia to ensure your comfort. Outpatient tubal ligation requires that a small amount of gas is inserted to inflate the abdomen. A laparoscope is then inserted into the abdomen and the procedure is performed. 2 other small incisions might be made for medical instruments to go through the abdominal wall. The tubal ligation will then be performed. Reasons for getting a tubal ligation procedure. There are many different reasons why a woman might choose to get a tubal ligation. You may want to have sex without worrying about getting pregnant. You might not want to deal with the side effects of hormonal birth control, or getting pregnant might put your health at risk. Some women don't want to pass on a genetic condition, while other women, along with their partner, might decide that their family is complete and they are then having children. It's a permanent decision that you must make for yourself. Possible risk and the side effects of tubal ligation. Though tubal ligation is highly successful for most women, it does have some risk. Fewer than 1 out of every 100 women might get pregnant after the procedure. Younger women have a greater chance of the procedure not working than older women. Women who do get pregnant after having a tubal ligation might experience an ectopic pregnancy. Other risks for tubal ligation include an adverse reaction to the anesthesia, infection, abdominal or pelvic pain that doesn't go away after healing, or damage to the bladder, bowel, or major blood vessels. Having diabetes, being obese, or having a history of abdominal surgery puts you at risk of complications.
Laparoscopy technique is a surgical technique procedure used to examine the organs inside the abdomen. So, pag sinabi natin laparoscopy, isa itong surgical procedure na ginagamit para ma-test or para ma-examine yung mga organs sa loob ng tiyan ng isang pasyente. Next, we have the laparoscope. Is a slender, lighted telescope inserted through the incision. Parang lapis lang siya. Ito yung ipapasok doon sa incision ng pasyente. Incision, ibig sabihin, ito yung sugat na ginawa ng OB doctor. Sugat siya, doon siya ipapasok yung isang tool para ma-examine yung sa loob ng tiyan ng isang pasyente.
Because both vasectomy and tubal ligation are nearly 100% effective pregnancy rarely, it is shown there is no effect on fetus. Dahil same ang vasectomy at tubal ligation ng 100%, ang effect na pagbubuntis ay bihirang mangyari o makabuo at wala itong epekto sa fetus. Then, if a sperm were present in a woman fallopian tube, prior to ligations on ovum could be fertilized into a blocked tube causing into ectopic pregnancy. Kapag naman ang sperm ay nag-present sa fallopian tube ng mommy or ng isang babae, magiging fertile ang sperm into a blocked tube at magkukos ito ng ectopic pregnancy. Surgical method and effect of sexual enjoyment. Both tubal ligation and vasectomy may lead to increased sexual enjoyment because they largely eliminate the possibility of pregnancy. Ang effect naman ng surgical method na ito ay nag-i-increase ng enjoyment sa dalawang couple in terms of sex. So, nag-i-enjoy ang dalawang couple dahil yun ang epekto ng surgical method sa kanilang dalawa. Ang effect nito sa dalawang couple ay nagbibigay ito ng enjoyment, excitement, and so on. Surgical method in adolescent. As a rule, counsel adolescent to use temporary forms of birth control because their future goals may change. That what they think, what they want at age 16 or 18 may not be what they desired at age 30 later. So, ang mga adolescent daw ay nagbibigay ng advice or guide sa atin or sa ating mga estudyante, especially sa mga taong wala masyadong alam about sa pag-birth control. Nagbibigay sila ng advice na gumamit ng condom, pills para sa safetyness ng dalawang couple. And then, if they still feel vasectomy or tubal ligation is the methods of reproductive life planning for them, the option will be available. So, yun na nga po. Sa mga adolescent is sila ang nag-guide sa atin para ma-avoid tayo or makaiwas tayo sa early pregnancy. Surgical method and premenopausal woman. When a woman realizes childbearing for her is completely vasectomy or her partner or tubal ligation for her are the two most frequently forms of contraceptions as they require no further expenses or motivations for success. So now, we are in the last part of my topic, surgical method and the postpartum woman. Tubal ligation can be done as soon as 4 to 6 hours after the birth. of the baby or after the elective termination of pregnancy, although it may be more common at 12 to 24 hours after birth. So, ang tubal ligation ay natatapos ito into 4 to 6 hours after manganak ng mommy or after manganak ng babae, or after elective terminologies ng pagbubuntis ng babae. And then, ang iba naman ay common ito into 12 to 24 hours after giving birth. Ibig sabihin, after manganak ng babae, matatapos na ito.